Great. You are live and ready to go.
Okay. Thank you, Brianna, for inviting me to give this brief talk on Plaquenil, otherwise known as hydroxychloroquine. My name is Dr. Wesley Mizutani. I am part of the Lupus LA Medical Advisory Board, also serve as the chairman of the California Arthritis Council, which is part of the Arthritis Foundation. We basically do a lot of advocacy within the state for patient bills that deal with patient rights of all types of chronic diseases. And I'm also the rheumatology lead at the Huntington Beach site for Optum Medical Group. So we only have 15 minutes. So I didn't want to get into a lot of detail about Plaquenil and make you kind of pharmacologic experts, but I did want to touch on a few subjects that kind of keep coming up. So let me give you a little bit of background though. Hydroxychloroquine is an interesting drug. It belongs to a group of antimalarials. There are other kind of antimalarials, for example, chloroquine, but we're really only going to talk about hydroxychloroquine today because that's the one that's mostly used to treat lupus and other collagen vascular diseases. It was discovered hundreds of years ago. In fact, the Incan descendants in Peru first used quinine, which was derived from bark, as a drug against a febrile illness, which could have been malaria, although we're not really sure from the kind of documents or whatever findings they've looked at back there. In 1894, Payne reported that quinine was effective in something he described that sounded similar to cutaneous lupus. In 1943, alkaloids, again from the bark of a tree, were made into chloroquine and tested in bird models. However, it never really got kind of approval by the physicians in the medical community. And it only was until World War II that it was used as an antimalarial prophylaxis. But it was also found at the same time that it seemed to improve rashes and inflammatory arthritis in those soldiers that used it. Next slide. So this is a picture of World War II, some medics, just to kind of give you the emphasis of the Plaquenil being first used really widely to prevent malaria. Next slide, please. So how does it work? Well, unfortunately, like many of the drugs that we use, or the older drugs that we use, really don't know exactly how it works. The actual mechanism is not really known. However, it is thought to decrease something called cell receptor signaling. I don't want to really get into details of that, but basically what happens is that for a cell to cause inflammation, it has to be activated. And whether that activation occurs on the surface of the cell or inside the cell, it makes a difference, but it both can cause the cell to be activated. Once the cell is activated, then it begins to produce these hormones we call cytokines, which all have inflammatory effects. So what the Plaquenil or hydroxychloroquine is thought to do is reduce the release of these hormones through its decreasing in the stimulation of these receptors that are usually inside the cell. Over the last 50 years, the use of hydroxychloroquine in rheumatic diseases has increased dramatically, as you can see in the next slide. So today we're only going to focus on the use in lupus, but obviously you can see that there are many other clinical uses in rheumatology practice. Next slide, please. So generally in lupus, it is used as a first-line drug. Well, what do I mean by that? Well, usually it's used as soon as the diagnosis is made and the rheumatologist feels that the patient needs something more than anti-inflammatories or topical steroids to control the disease. And at least initially in many patients is used as a sole drug. It's not added to, it's not given with something else, although some patients who are started on steroids will also be put on Plaquenil at the same time. But by itself, it's only really indicated for either mild arthritis or mild to moderate skin rash. However, there are potential hidden benefits, which just recently came to light about maybe 5 years ago. There's been a lot of studies looking at cardiovascular disease in lupus patients, and the incidence of cardiovascular disease, heart attacks, strokes, etc., is increased in many patients with lupus. Studies have shown that when Plaquenil or hydroxychloroquine is used, it seems to decrease those risks. And that is why patients who may be even asymptomatic, their rheumatologist may prescribe Plaquenil to reduce the incidence or the risk of those cardiovascular events. Next slide, please. So this is a photograph of Rodin's Thinker, and just to get you thinking about side effects. Next slide, please. So the common side effects that many patients will find is stomach upset, although it's usually mild and usually goes away after the first week or so. Headaches, the same thing, usually mild headaches, and usually goes away after the first few weeks. Hyperpigmentation can be an issue with some patients, especially patients who are darker skinned, or they can actually get just the opposite, hypopigmentation. Although, again, it's not very common that we see that. And then allergic type skin reactions, much like you would get in a penicillin allergy or something like that, although not usually to the same degree, you can get rashes as well. But the main focus over the last, I would say, 10 years has been the eye problem. So what happens with a hydroxychloroquine use is it can, although it's not common, but it can cause some retinal problems or problems with your eyes. But there's some discussion or discrepancy between the rheumatologist take on this subject and ophthalmologist take. So over the years, we've been using a hydroxychloroquine as a rheumatology community in lupus for probably, I don't know, 70 years. And over those 70 years, we never really worried about the dose of hydroxychloroquine or Plaquenil, as long as we felt the patient was seen yearly or annually by ophthalmologists to look for the potential retinal problems and pick it up, then usually most patients did fine. However, there was a couple studies that ophthalmologists did, maybe about 7 years ago, which kind of turned this subject on its head, because what happened is the ophthalmologists came out to say, the papers came out to say that there was a risk that was higher than what we as rheumatologists had thought that Plaquenil could cause in terms of eye issues. And they recommended lowering the dose of Plaquenil so that we would avoid that toxicity. Now, rheumatologists didn't completely buy and the American College of Rheumatology didn't completely buy all of the ophthalmologist guidelines. What they did buy was that we should change the way we dose Plaquenil, and instead of just giving a flat dose, we base it based on kilogram weight. So generally speaking, it's 5 milligrams per kilogram weight. So let's say, to make it easy, you were 100 kilograms, then 100 kilograms per day would be 500 milligrams a day, which is usually the higher dose than we usually use. The standard is 400 milligrams a day. But you can see that if patients weighed less than 100 kilograms, then that dose would have to be reduced correspondingly. We still recommend ophthalmology exams annually to prevent the retinal issues, because ophthalmologists can find the problem prior to you developing any symptoms. So it is, again, important to get ophthalmology exams if you are on Plaquenil, but I think that the hoopla that ophthalmologists kind of put on the eye issues with Plaquenil is a little bit overdone. Next slide, please. Rarer side effects that we can see with hydroxychloroquine are neuropathy, which just means that you get numbness in your legs or hands. It's pretty rare. Probably happens in less than 1%. Heart issues has made a lot of press, I think, during the COVID time because of the theory that Plaquenil would help COVID. It actually didn't, as most of the studies would show. So, but the heart issues were outlined as a way of a reason not to take it. However, the incidence of heart issues are really, really rare. And then aplastic anemia is also a rare side effect. So next slide, please. So in a brief kind of 15-minute or 12-minute stint here, we tried to get you to understand a little bit about the origin of Plaquenil, the potential uses of Plaquenil, how it potentially works, although we don't know for sure. And then the side effects, the main one being the retinal issue and how that rheumatologists differ somewhat from ophthalmologists in terms of the seriousness of that. But we all kind of agree that annual ophthalmologic exams should be done. And hopefully I didn't confuse you as this painting by Picasso shows. It is a typical cubism. And for those of you who don't understand cubism, because I didn't for years, cubism just doesn't mean that it's cubes. Like you can see there's, kind of squares and so forth, but it really emphasizes the fact that you can look at this painting and see different things, looking at it from different angles, and you can't really tell, is it right side up, upside down, looking from the top or the bottom. And then I guess we're going to look to see if there's some questions.
Yeah.
Okay.
Thank you so much for your time. We do have a couple quick questions. So the first is that I heard that taking hydroxychloroquine can prevent vitamin D conversion. Does it help to take it orally when you're on hydroxychloroquine?
No, we don't use it for that specific purpose. And I think that the pharmacology of that is just that it may increase it a little bit, but it's not significant enough to use it as a vitamin D supplement or so forth.
Understood. Our next one is, can Plaquenil cause muscle weakness? And if so, why is that?
We don't really know how Plaquenil works from a side effect perspective. It can cause myalgias and therefore cause muscle weakness because of pain. Much like the cholesterol medicine that you take, we don't really know why it causes muscle issues. It just can. So the same reason why we don't know why it necessarily causes ophthalmologic issues, it just does. But yes, it can cause myalgias, meaning muscle aches and pains, and sometimes weakness, yes.
Great. And is it safe to be on Plaquenil for your whole life?
Yes, we have many patients who are on Plaquenil for their whole life. Now, again, getting back to the ophthalmologist reports, they would say, well, we shouldn't be on it for a lifetime. And in fact, there's some ophthalmologists that we encounter in the community that tell us, this patient should be off of it, or blah, blah. But if you talk to the real rheumatologists that are the academicians, the kind of gurus, if you will, of lupus nowadays, including several in our community, they will say that the Plaquenil can be used for a lifetime. I think you just need to make sure that the dosing is appropriate, as I said before, usually 5 milligrams per kilogram per day, total dose.
Okay, great. Thank you so much. We really appreciate your time, Dr. Mizutani. Thank you.
Okay, well, thank you for having me, and have a great afternoon.